Well, welcome back to Insight. We are talking about COVID-19, the pandemic with Aging and In-Home Services of Northeast Indiana. Megan's joined us, and we talked about it last month and what effect it's having on the seniors in our community, what you guys are doing, but it's still happening.
Unfortunately, it's still happening. It's exciting though, because it seems like our social distancing is working, so definitely keep doing that. Yes, you guys, we had Maureen here from our team at Aging and In-Home Services, but then Erica and Dr. McMahon joined you just to talk about some of the more logistics and medical terms and everything that was going on. But yes, COVID-19 is still very much around, unfortunately. And as you guys learned last month, it does affect seniors a little bit differently. We have to be extremely just cautious because they are immunocompromised.
Sure.
That's just plain and simple. We have learned that immunocompromised individuals take this a little bit harder than the average human. So we just have to take some extra precautions and make sure that their health, well-being, safety, but also their nutrition and things are staying up to par so that if they were to contract something, they're at least in a situation where hopefully they'd be able to fight through it.
Absolutely. Now, you guys are still operational. You are still functioning at full force, but just a little differently.
Just a little bit differently. So we have through the Family and Social Services Administration down in Indianapolis, they granted all area agencies on aging to do what's called telecommunication, essentially. Telehealth. Essentially, all of our case managers and option counselors, they're still working full force just from the safety of their homes, and they're doing everything over the phone.
Okay.
So you can still call in, you will still get assessed, we can still do everything that we were doing, we just won't be able to see you face to face, which means no walk-ins at this time. We typically do allow walk-ins, but because of the situation, we are not allowing walk-in appointments at our offices. Just for the safety of you and obviously for the safety of our staff. But we have upped the capacity for those calls coming through because we have seen a little bit of an increase with just people having questions and needing resources, in which that's okay. I was talking with my team this morning, and we've been working with these clients, our clients, for years. So we know what they need, what they expect, and things that can help them through, because we have been working with them. We know those things. We're hitting a different animal right now. We're hitting people that we haven't met before. We haven't talked before. And so it's a little bit different because we need help figuring out really what they need and things that will help them get through this. So something that we've discussed is definitely, if you are in need of anything, call us and let us know what you need. The more that we know what you need, the more we can help you. So even if it's just advice on, hey, we really need toilet paper, we cannot find it, call us and let us know that so we can connect you with some. Yeah.
Sure. Well, you mentioned Dr. McMahon and Erica and Maureen being here last month, and they went over a few things that you can be doing. And I know we've all talked about this. We've seen it in the news. We've seen it in other things. But sometimes it can get confusing.
Absolutely.
Because, we're getting hit with all these different things, and we don't know what's true and what's not true, and there's just a barrage of information.
Absolutely.
So let's just kind of go over a few things that we can do to maybe prevent, to keep ourselves as safe as we can. And you mentioned first, the most important, that social distancing.
Yep, keep the space.
Yes, look at us. We air hugged when she came in.
Yes, we did. I do miss you. I miss being here. Definitely keep your space. Be aware, be self-aware. When you're in the grocery store, if you have to go to the grocery store, those carts are pretty big.
Right.
Keep some distance, people. But obviously, the things that are just funny, wash your hands.
Yes.
Why weren't we washing our hands like this before?
Well, and it's funny. I talked about that with Dr. McMahon. Apparently, we were doing it all wrong before.
20 seconds.
Yes.
Water, soap, in between the fingers.
Your thumbs are really important.
The thumbs.
My daughter taught me. You got to make sure you're getting your thumbs.
But just being safe, knowing what's an essential trip. If you need food, if you need groceries, obviously that's essential. If you want to go hang out with your best friend, turns out
not essential.
You can't do that right now. We shouldn't do that right now. And there's a reason why you shouldn't, because if you have seen, it's working. So just keep push through this time. I know it's hard.
There have been all different, at the beginning, no mask, and then mask, and all this different stuff. Now they're saying, wear the masks if you're going out.
And really, that's just the masks, like those cloth masks and stuff, those keep your germs in.
Right.
So you might not know that you have it because some symptoms you're asymptomatic. So just prepare and just be cautious. Just be cautious is really all we can say.
And listen, if we're cautious now, maybe we can move on quicker, and that's what we all want.
I want a normal summer, people.
I do too. I want summer, period.
Don't we all?
Well, you mentioned the nutrition program continues. We want to talk about that, and we will do that when we come back. We'll be right back.